one of the things we can do is we can try and get ahead of it. That's really the more we can get ahead of this. So in preparation for, having a needle, an injection or a blood draw or whatever. So let's do a little exercise right now, all of us. So placing one hand on your chest and one hand on your abdomen, and just take a couple of breaths and see where you feel your breath most strongly. Do you feel it in your chest or in your abdomen or both?
I feel it in my abdomen.
Okay.
And so just for the listeners, I'm assuming we're not supposed to change anything. We're just noticing what is naturally happening. Okay.
Exactly. So, and if you're feeling a little relaxed right now, then you might feel it mostly in your abdomen. And if you're feeling a little anxious, you might feel it mostly in your chest. And so this is important. So one of the things we want to do is we want to pull the breathing from the chest to the abdomen. Another trick that I find to be really useful for noticing where the breath is to putting your hands like this on your side by your rib cage and taking a couple of breaths. And does your rib cage move?
Mine does.
Was it just a little bit?
Yeah, it's like going out a little bit, I think.
So when you're feeling really anxious, I find this to be a really useful tool for figuring out if we're taking big, deep breaths. Because being able to really feel those rib cage, the rib cage expand and contract, that can really, it's a good trick for figuring out, am I taking in that big volume of air that you was talking about? And is my breathing more in my chest than in my abdomen? So we really want to pull the breathing down to the abdomen to where the rib cage really isn't moving. And so again, the volume is so important, and there's so many ways that we get taught around our breathing to take a deep breath. So this is going to feel a little weird at first. It just is. And so the good thing is the good news is that over time we can get better and better at it. So what you want to do is, this can be really good feedback. And so breathing with your nose, with your mouth closed, and really focusing on keeping this hand on the chest totally still. And the one on the abdomen can move a little bit, but again, these are really small bits of air coming in and out. Just try and take a few very gentle breaths. Gentle, that's waves sliding in and out on the sand. What are you noticing? One of the really important tricks that if you are anybody, as you're out there and you're going to actually be practicing this, one of the things you want to do is you want to check for hyperinflation. So what this means is when we're feeling really anxious, we tend to take a big breath of air into our lungs, and then we only breathe out a little bit at a time. So we're kind of breathing in and out, just a little bit of, in a way, we're just breathing that little bit of air, but it's because we've filled our lungs and now we're breathing with our chest. So whenever you're doing this, always start by completely exhaling first.
I think it may be important to mention that for individuals that chronically hyperventilate, which, for example, in our panic populations that we and others have studied, it's the majority of the patients. So at any given time, not when they're having a full-blown panic attack, they are habitually overventilating. So they're taking in too much air without noticing it. They will oftentimes, in fact, say, I feel short of breath all the time, which, is counter to what is actually happening. When they do this exercise, they will not feel very relaxed and happy and content. In fact, most likely they will feel as if they're not getting enough air, as if they're suffocating. It will feel very unnatural. And it is, because it is in some ways like a person that has been drinking 10 cups of coffee a day, and suddenly you ask this person to only drink 2. It's the same. This is the person who has habitually breathed more air than necessary, and now you're asking this person to breathe much less, even though it's better to drink 2 instead of probably 10 cups. It still feels as if something is really wrong. And in fact, they will feel as if they're not getting enough air. And that can be extremely anxiety provoking. Now, in our studies, what we were able to use is to assure our patients, and not just our anxiety patients, but also our asthma patients, that they're not suffocating. Is we had an oximeter device so that would measure their oxygen, and they could see that when they were breathing normally, meaning hyperventilating, for example, that their oxygen was 100%. And when they were breathing less air, it was also still 100%, or it was 80, it was 98%. It minimally changed because when you overbreathe, of course, then you are at 100%. But when you're breathing normally, then you're in the normal range of oxygen, and you will stay there.
Just one quick question. So breathing in through the nose, and then Dr. Simon, you were saying that sometimes some have a tendency to not fully breathe out. Should one breathe in this kind of small volume breathing, breathe out through the nose or breathe out through the mouth?
You want to breathe in and out using the nose for both, because when you breathe out through your mouth, what's happening is you're dumping CO2.
Okay.
And then those CO2 levels go down, and that's what's creating the sense of breathlessness.
Okay.
The other thing too, what's super interesting, the exhalation is actually where the parasympathetic part of our nervous system gets activated. It's super fascinating. So when we're inhaling, our sympathetic nervous system, or the part that controls fight or flight response, when we inhale, it activates that part. And when we exhale, it activates the parasympathetic response, or our relaxation response. And this is really important because when we're feeling fearful and anxious, our inhalations get bigger and our exhalations get shorter. And so it's especially important to focus on, and one of the things we did is, exhalations when we're breathing optimally are about twice as long as our inhalations.
Very interesting.
And then there's a little pause at the top of the breath, and there's a little pause at the bottom of the breath. But when we're breathing, because we're scared, we start we take, that's more of the breathing pattern. And you can actually notice over time, you can start really feeling it. What were you saying, Alicia?
Yeah, I wanted to add to that. That's what typically people feel, hyperventilation will look like, this panting. And yes, it can. But we have certainly seen clients in our studies that they did not at all look as if they were hyperventilating. They habitually hyperventilated, and then when they were exposed, it took them 1-2 breaths to really have a very low level, and you would not be able to see that. Neither did they. And when we would tell them you are in a quite substantial range of hyperventilation, it would be shocking to them because that's not what they associated with it, because that's what we oftentimes see, in movies or in the media, the person that's panting, right? But that doesn't need to be the case. You can hyperventilate without really seeing it.
It's usually much more subtle. Yes, totally. It's our conceptualizations of what it looks like and versus what we actually see. And it's the outcome is that the inhalations are bigger, the exhalations are shorter, and then there aren't the pauses. And so just being able, one of the tricks we also talked about is, how do you actually notice how you're breathing when you're totally relaxed? If you don't have this tendency towards over breathing all the time. One of the things that can be useful is also, how are you breathing just as you're falling to sleep? respiration really changes as we're kind of shifting into that sleep phase. And so there's just different kind of tricks like this. But ultimately, what we really want to do is make sure you've exhaled completely. You don't have that hyperventilation. You want your torso to really be relaxed. You know, we tend to kind of hunch up and kind of breathe like this, really like relaxed breathing, those little sips of air, breathing with the abdomen, and it can take a little bit of time. So when you're first learning this, you do kind of want your abdomen to move a little bit, because you want to get that sense of feeling of abdominal breathing versus chest breathing. So it can take a little bit. We're told we're supposed to like kind of hold in everything, you know, it's kind of just the messages we get in our modern world. So being able to relax the abdomen so that that can be the diaphragmatic breathing is what's occurring, not the chest breathing. If that
So
makes
one
sense.
tool to help with maybe before having a shot, manage needle phobia, is kind of practicing gearing up with this breathing retraining of these low volume breaths that Dr. Murray and Dr. Simon are sharing. So that's kind of one really good tool in the toolbox to work on. And it sounds like it's going to take a little bit of practice, which is a good thing to practice.
It can help to combine that with visualization of the situation itself. So which would be a form of, imagine exposure. And so, for example, looking at pictures of needles, looking at videos online, which there are now many, about the procedure, and then practicing the shallow breathing while doing that. But as you said, this is one technique, and I think we should probably also briefly talk about the applied tension, because that is an important technique too, and combining the two is probably a good idea.
So the applied tension technique is super easy, just super easy, and will take almost no time to describe. So what we want to do, if you have a fainting response, even if you just the fear response, the applied tension and the breathing technique have both in our research were pretty equal in how well that they countered both the fear and the fainting response. So, and you can totally use them in conjunction. So the applied tension technique at its very basic is we're tensing the major leg and torso and arm muscles, just so that we get that blood flow back to the heart and brain. So we're also doing a physical technique. So when we talk about that metabolic activity, we're actually using our muscles, we're using some of that oxygen that we're over breathing in. So what you want to do is you don't want to do it too hard. So you're about like a 65 to 70% of effort of attention. You can play around with it for what works for you, but that's, you don't want to do too much and get like super tense. But what you're doing is you are tensing and then you're releasing. You're not relaxing though. This is really important. You're tensing and then you're just releasing the tension and going back to that baseline level. We always have a certain amount of just structurally for us to be able to sit upright. Our bodies
When you say
are
relaxing, releasing versus relaxing, what does that mean?
So our bodies unless we're like laying down, our bodies always have a certain amount of tension that is just structurally necessary for us to hold ourselves upright. You're sitting because your body, your muscles are being utilized to hold you in a certain position. So relaxing, when we're actually relaxing, what we're doing is we're releasing beyond this level of tension, the natural baseline amount of tension that we have in our body. And so what we don't want to do is actually release to a point where we're kind of contributing to our body's changes in the heart rate and the blood pressure and all of that can lead to fainting. If that
you don't
makes
want to
sense.
go along with the parasympathetic, the dropping of the blood pressure.
Exactly. You're countering this biphasic response. So that second phase where everything decreases, blood pressure decreases, heart rate decreases, because that's the part that leads to fainting. Nobody faints when they're in a sympathetic response. Nobody faints when they're being chased by the by the tiger. And this is actually really interesting, as we also saw in our research, that or just general knowledge, is that people do not tend to pass out when they get the injection. They pass out
before.
afterwards.
Oh,
you know?
after.
So you basically have removed already the threat. They felt very, very anxious, of course. So they were in that sympathetic phase, and then they relax. And this is, that second phase,
Right.
the biphasic response, where they pass out. This is when you want to tense to avoid.
How many seconds at a time should the tension be held? Ish.
Like 10 to 15 seconds, and then releasing for 5, tensing for 10 to 15 seconds. You're kind of pumping. It's like a mechanistic way of like pumping blood back up into the torso and the brain. And so there's so many nuances around parasympathetic versus sympathetic and relaxation responses, specifically with this particular pattern with the fainting. So I think what, I want to also just highlight is that when we were talking about extending the exhales, that part's still really good. What we're doing in that is we're countering the fear response. And then when we're countering the fear response, we're preventing ourselves from going into the fainting response. And there's just a ton of nuances, way more than we want to get into, but just the goal of this is that the parasympathetic activation is what can lead to that second part of the diphasic response. And the tension can counter that, but it's countering the blood pressure changes, not necessarily the parasympathetic. It's tricky, if that makes sense.
Sure. Would it be fair, though, say somebody's waiting to get just like a rule of thumb, like 5 rounds of this, 3 rounds? I just don't want someone to think that they have to spend like all day before they're getting ready.
In essence, as long as they have the symptoms.
As long as one is feeling.
They're short-lived when people have when they get a vaccination or when they get a blood draw. So there is the anticipatory phase, but it comes in waves. These
so when you're having that wave,
right? They come
during
in
that wave to
right. I think what's important to mention is what doesn't seem to help. And again, we and others have demonstrated that in our studies, is relaxation. So this attempt of trying to relax. It is very much like telling someone, don't think about a white bear. Of course, all they can think about is a white bear. Don't think about your anxiety. All they can think about the anxiety. Try to relax. The opposite tends to happen. But also in the context of what we just discussed, that there is this biphasic response, you would add to the probability of passing out because you're relaxing the body, which leads to that parasympathetic response, or supports parasympathetic response.
And it's nice to know what you can do. We can't always control all aspects of life and anxiety, but having these tools in the toolbox are very helpful. So thank you both so much.
It's been a pleasure to be here.